Good afternoon, everyone. Respected delegates and participants, I am Dr. Jagriti Talwar, Assistant Professor, Department of Shalakya Tantra, Ayurveda in Abhilasha University. So, uh, today's topic of presentation is epistaxis, which in general is known as bleeding from the nose or bleeding from the nasal cavity. Epistaxis is fairly common, and about 60% of population experience a nosebleed at least once in their lifetime and is seen in all age groups. The condition is common in childhood, becomes less common in early adult life, and then peaks in the sixth decade. Children are mainly susceptible to nosebleed due to the rich vascular supply of the nasal mucosa, and since they develop more upper respiratory tract infections. Epistaxis often presents as an emergency and it should be treated accordingly. It is the it most commonly originates in the anterior portion of the nasal cavity. So, what is nasal cavity? Nasal cavity is the most cephalic part of your respiratory tract, which communicates with the external environment via the anterior apertures called nares, and with nasopharynx via the posterior aperture called choana. Now, what is the definition of epistaxis? A hemorrhage from the nose, referred to as epistaxis, is caused by the rupture of tiny distended vessels in the mucous membrane of any area of the nose. These vessels, we are talking about the tiny and distended vessels, means there is vasodilation of the vessels. And what are these vessels? To know about these vessels, one should be able to know about the blood supply of the nasal cavity. So, what is the nasal blood supply of nasal cavity? Two main systems, internal carotid system and external carotid system, give branches of arteries which supplies the septum as well as the lateral wall of the nasal cavity. So, like anterior ethmoidal artery and posterior ethmoidal artery, which arises from the internal carotid system, and external carotid system give rise to sphenopalatine artery. Then there is septal branch of greater palatine artery and septal branch of lesser palatine artery, which arises from the external carotid system, and along with these arteries, there is facial artery which supplies the nasal cavity. In this image, you are able to see the blood supply of nasal septum. So, if you So, as you all can see, internal carotid artery gives ophthalmic artery, and further branches of ophthalmic artery are anterior ethmoidal artery and posterior ethmoidal artery, which supplies the anterior superior and posterior superior part of the nasal septum. Then there is external carotid artery, which give rise to maxillary artery and facial artery. From facial artery, the branch of sphenopalatine artery and greater palatine artery supplies the posterior and inferior portion of the nasal septum. Then there is superior labial artery, which arises from the facial artery, and its septal branch supplies the anterior inferior part of the nasal septum. And this is the supply of the blood supply of the nasal septum. If we talk about the blood supply of lateral wall of nose, then almost all arteries like anterior ethmoidal, posterior ethmoidal, branches of sphenopalatine artery, lesser palatine, greater palatine. These arteries are similar for blood supply of lateral wall of nose and blood supply of the septum, as we have discussed in this slide. But the only difference is, in case of lateral wall of nose, facial branches directly from the facial artery supplies the anterior inferior part of the lateral wall of nose, whereas in previous slides when we were discussing the blood supply of nasal septum, septal branch which arises from the superior labial artery was supplying the anterior inferior part of the nasal septum. So, what sites of the epistaxis? What are the sites? If we go anteriorly to posterior end of the nasal cavity, there are mainly three sites which are prone to bleed. Or we can say these areas are most commonly responsible for the bleeding from the nose. Most anteriorly is Little's area, which is found responsible in 90% of cases. There is little area, then there is the retrocolumnar vein, and most posteriorly is present Woodruff's plexus. Other than this, the area above the level of middle turbinate, area below the level of middle turbinate, then there is posterior part of the nasal cavity, and to which we are calling the Woodruff's plexus, are the sites of epistaxis. Sometimes epistaxis is diffused, means bleeding है, it comes both from the septum as well as from the lateral nasal wall. And in some cases, nasopharyngeal bleeding is also responsible for the bleeding from the nose. So, what is Little's area? Little's area is situated in the anterior inferior part of the nasal septum, just above the vestibule. So, what is vestibule? It is the entrance of your nasal cavity. Vestibule is the anterior and inferior part of nasal cavity, which is lined by the skin and contains sebaceous glands, hair follicle, and the hair called vibrissae. So the area which is present just above the vestibule is called Little's area, and four arteries: anterior ethmoidal, septal branch of superior labial, septal branch of sphenopalatine, and the greater palatine, anastomoses here to form a vascular plexus called Caselbach's plexus. What is a plexus? Plexus is a network of vessels. So this area is exposed to the drying effect of inspiratory current and to the fingernail trauma. क्योंकि जो Little's area है, it is present anteriorly in your nasal cavity. So this area is prone for fingernail trauma and is the usual site for epistaxis in children and young adults. This is the image showing Little's area, where you can see this orange shaded area is called Caselbach's plexus, and it is formed by the anastomosis of branches coming from the sphenopalatine artery, anterior ethmoidal artery, and septal branch of superior labial artery, along with greater palatine artery. Now, what is Woodruff's plexus? As we have discussed earlier, Woodruff's plexus is present posteriorly in the nasal cavity. It is a plexus of veins situated inferior to posterior end of inferior turbinate. It is a site of posterior epistaxis in adults, and most commonly, this Woodruff's plexus is responsible for bleeding in elderly people. In image, you can see, if you see the posterior end of nasal cavity, this encircled area is Woodruff's plexus, and it is the site of origin of posterior epistaxis. Along with Woodruff's plexus, Caselbach's plexus is also mentioned in this image. After Little's area and Woodruff's plexus comes the retrocolumnar vein. As the name suggests, retro means behind, columnar means behind columella. What is columella? Actually, columella is the bridge of the tissue that separates the nostrils at the bottom of your nose. So, there is a vein that runs behind the columella and crosses the floor of the nose and joins venous plexus of the lateral nasal wall. This is a common site of bleeding in young people or adults. Now, we'll discuss causes behind epistaxis. So, causes can be divided mainly into three. Local causes of epistaxis, which are present either in nose or nasopharynx. Then there are general causes, and some causes of epistaxis are idiopathic. Most common cause of local nasal bleeding are trauma. Trauma to nasal cavity due to fingernail trauma, or it could be an injury to nose, or violent sneeze, or even sometimes hard blowing of nose can cause bleeding from the nasal cavity. It is seen in individuals who are having long-term use of intranasal corticosteroidal spray, that these the nasal mucosa of those individuals become atrophied, or we can say excessive use of corticosteroidal sprays make the mucosa of the nasal cavity very fragile, dry, which leads to bleeding even after having a hard blowing of nose. Then there are some infections which are responsible for epistaxis, which includes, if we talk about the acute conditions like viral rhinitis, acute sinusitis, and some chronic conditions like all crust forming diseases like atrophic rhinitis and rhinitis sicca. In these chronic conditions, due to these atrophic rhinitis or rhinitis sicca, there is atrophy of the nasal mucosa, and the nasal cavity is prone to bleed in these cases. Foreign bodies are another one of the cause behind the bleeding from the nasal cavity. And foreign bodies can be divided into living and non-living. Non-living may be any neglected foreign body, which in turn results into rhinolith formation. And living foreign bodies can be maggots or leeches inside the nasal cavity. Some neoplasm of nose and paranasal sinuses like benign hemangioma, papilloma, and malignant like carcinomas or sarcomas of nasal cavities also result into the nasal bleed. There are some atmospheric changes like when we go high up in altitudes. We all know that atmospheric pressure decreases with increase in altitude. Therefore, as we go higher, the pressure within the blood vessels exceed the outside pressure. This causes the blood vessel to rupture and resulting into bleeding. And same happens during sudden decompression. Then there are some cases of nasal septum deviation or nasal septal spur, which the patients with these conditions are associated with nasal bleeding. If we talk about the area nasopharynx associated bleeding, so that can be due to adenoiditis, juvenile angiofibroma, or malignant tumors of the nasopharynx. What is adenoiditis? It is a condition seen in children. Adenoids are the nasopharyngeal tonsils, and sometimes inflammation of these tonsils resulting to bleeding. Then juvenile angiofibroma, it is a uh, it is a benign vascular tumor inside the nasopharynx and most commonly seen in teenager boys. This condition is most commonly seen in teenager boys and may be responsible for bleeding because juvenile angiofibroma is a vascular growth. So it is susceptible for bleeding. And sometimes malignant tumors of nasopharynx can also be the reason behind nasal bleed. Next comes the general causes of epistaxis. General causes of epistaxis are associated with the systemic conditions of the body. In case of cardiovascular system, epistaxis can be seen in patients having hypertension or arteriosclerosis or mitral valve stenosis. Some some liver diseases like hepatic cirrhosis is also responsible for epistaxis, and sometimes excessive use of salicylates and other analgesics. Uh, as for joint pain or headaches, um, and some patients on anticoagulant therapy is also susceptible for nasal bleeds. Then there are some chronic conditions of kidney, like chronic nephritis and vicarious menstruation. Vicarious menstruation is epistaxis occurring at the time of menstruation. And many times the cause of epistaxis is not clear, and that condition is called idiopathic. So this was all about the causes from local to general causes of epistaxis. Now, what are the types of epistaxis? Epistaxis can be of two types: anterior epistaxis and posterior epistaxis. When blood flows out from the nose, out from the front of the nose, with the patient in sitting position, it is called anterior epistaxis. And in posterior epistaxis, mainly the blood flows back into the throat, and patient may swallow it and later have a coffee colored vomitus. Anterior epistaxis is most common and less severe and easy to control, whereas posterior epistaxis is less common. Anterior epistaxis is most common and posterior epistaxis is less common, more severe and difficult to control. If we have to differentiate between anterior and posterior epistaxis, these are some points. If we talk about the incidence of the anterior epistaxis in comparison to posterior epistaxis, anterior epistaxis is more common than posterior epistaxis, and site of the epistaxis in anterior epistaxis is mostly from the little's area. As we have already discussed, 90% of anterior bleed cases are from little's area or anterior part of the lateral wall, whereas posterior bleeds occurs from the Woodruff's plexus, or we can say from the posterior part of the nasal cavity. Anterior epistaxis is mostly seen in children or young adults, whereas posterior epistaxis is seen commonly in elderly people above the age of 40 years. Now, the causes behind most common causes behind the epistaxis are, in case of anterior, mostly trauma or by nasal mucosal dryness. Posterior epistaxis is spontaneous in nature and often due to hypertension or arteriosclerosis. If we talk about the bleeding in case of two type of epistaxis, in anterior epistaxis, bleeding is usually mild and can be controlled by local pressure or anterior packing. And in case of posterior, bleeding is severe and requires hospitalization of the patient along with post-nasal packing. So up to this point, we have discussed about the definition of epistaxis, nasal blood supply, then the types of epistaxis, and how will you differentiate between two. Now comes the methods of management, how one can or a clinician can attend a patient with nasal bleed. In any case of epistaxis, it is important to know the mode of onset, whether bleeding from the nose was spontaneous or due to fingernail trauma or any other cause. Duration and frequency of bleeding should be known. Amount of blood loss, whether the bleeding is coming from anterior part of the nose or going posteriorly. Any known any known bleeding tendency in the patient or family should be ruled out. Then history of drug intake, whether patient is having any medication like analgesic or anticoagulant therapy should be cleared while managing the case of epistaxis. Management strategies of epistaxis are variable depending on the severity of bleeding. If a patient is having mild nasal bleed, then in this condition it can be checked simply by first aid methods, which includes pinching the nasal cavity. There is Trotter's method or cold compression, or by applying cold compression. What is pinching? Pinching the nose with thumb and index finger for about 5 minutes. What will happen? This will compress the vessel of the Little's area and bleeding will be checked. In Trotter's method, patient is made to sit leaning a little forward over a basin to spit any blood and breathe quietly from the mouth. Then cold compressions are given to the nose to cause reflex vasoconstriction. As we all know, bleeding was occurring from the tiny dilated vessels. So when we apply ice or something cold over the nasal cavity, that causes vasoconstriction, and by these methods, we can check mild cases of epistaxis. Here you can see in these pictures, there is an image of individuals pinching their nose, which will check the bleeding, and Trotter's method is showing as a lady is being seated on the chair, leaning slightly forward and breathing quietly from the mouth. Along with first aid, what could be done to check the nasal bleed is cauterization. What is cauterization? Cauterization is the process of destroying tissue with electricity or chemical. For this, first of all, we have to locate the bleeder into the nasal cavity. Then, the area is first anesthetized and the bleeding point cauterized with a bead of silver nitrate, which will be under chemical cauterization, or the bleeder can be coagulated with electrocautery. Along with these methods, there is anterior nasal packing when the bleed is coming from the anterior part of the nasal cavity. What is to be done? A ribbon gauze soaked with liquid paraffin is used. Dimensions are 1 meter gauze, 2.5 centimeter wide in adults and 12 in children is required for each nasal cavity. First few centimeters of gauze are folded upon itself and inserted along the floor, and then the whole nasal cavity is packed tightly by the layering the gauze from floor to the roof and from before backwards. One or both cavities may need to be packed, and the pack can be removed after 24 hours if the bleeding has stopped. If it has to be kept for 2 to 3 days, systemic antibiotics should be given to prevent sinus infections and toxic shock syndrome. This is the image showing anterior nasal packing, where you can see, first of all, with the help of a forceps, the ribbon gauze is inserted along the floor of the nasal cavity, and then onwards, whole of the nasal cavity is packed with the gauze from floor of the nasal cavity to top, and from backward to from anterior to posterior end. Now, posterior nasal packing. This type of nasal pack is required in patients having posterior nasal bleed. A post nasal pack is prepared by tying 3 silk ties to a piece of gauze rolled into the shape of cone. And in this case, for posterior nasal packing, patient has to be hospitalized. Along with posterior nasal packing, nowadays Foley's catheters and nasal balloons are also available, which will check the posterior bleed from the nasal cavity. This is the image of posterior nasal packing, where you can see a gauze. If you see the posterior end of the nasal cavity which opens into the nasopharynx, you will see a posterior pack there, and anteriorly gauze is placed in the form of a bolster, and along with posterior packing, anterior pack is also given to the patient if the bleeding from the nose is diffused. Sometimes cauterization can also be done under the surveillance of endoscope for posterior bleeding points after located with endoscopes, which is called endoscopic cauterization. All these methods we have just discussed are under non-surgical methods to check the bleeding from the nose. And sometimes, if the bleeding from the nose is refractory, or we can say is recurrent bleed from the nasal cavity, then some surgical methods has to be applied. For that, there is elevation of mucoperichondrial flap or SMR operations, or septoplasty for the correction of deviated septum or any type of nasal spur. So, what is to be done? In case of persistent or recurrent bleeds from the septum, elevation of mucoperichondrial flap and then repositioning of it. What does it cause? It helps to cause fibrosis and constriction of blood vessels. And SMR operations, which are called submucosal resection operations, are helpful in removing the septal spur, and along with it, septoplasty can also be applied to correct the deviation of the nasal septum. This is an image of a Foley's catheter inserted along the floor of the nose, and balloon is inflated in the post-nasal space to check the post-nasal bleeding. Then there is an image of the nasal balloons. First image is having a non-inflated balloon. Then when this nasal balloon is inserted into the nasal cavity, it is not inflated. As we insert the nasal balloon inside the nasal cavity, then the balloons are inflated and will help to check the bleeding from the nasal part of the cavity, from the posterior part of the nasal cavity. Along with SMR operations, or elevation of mucoperichondrial flaps, there is the ligation of main vessels supplying the nasal cavity can be done. It includes the ligation of external carotid artery above the origin of superior thyroid artery. Embolization or ligation of more peripheral branches can also be done. Then there is maxillary artery. In this case, ligation in uncontrollable posterior epistaxis. If there is posterior epistaxis which cannot be controlled with the help of posterior nasal packing or any endoscopic cauterization, then maxillary artery ligation can be done. Endoscopic ligation of the maxillary artery can also be done through nose. Then comes the ligation of ethmoidal arteries. So, in anterior superior bleeding above the middle turbinate, the vessels are exposed in the medial wall of the orbit by an external ethmoidal incision. So, this is an image showing ligation of sphenopalatine artery, in which with the help of endoscope the bleeder is located first, and if the bleeding area is from sphenopalatine artery, or the area which bleeds is associated with sphenopalatine artery, then this area is clamped so that bleeding from the posterior part of the nasal cavity can be stopped. After checking the bleeding from the nasal cavity, there are some general measures which should be kept in mind, like make the patient up with the backrest and record any blood loss through spitting or vomiting. Reassure the patient, and mild sedation should be given. Keep check on vitals. Vitals like pulse, BP, and respiration should be checked. Sorry. Antibiotics to prevent sinusitis if pack is to be kept beyond 24 hours. Intermittent oxygen may be required in patients with bilateral packs. And at last, investigate and treat the patient for any underlying local or general cause. With this, I would like to end this presentation here. Thank you so much, everyone, for your kind attention and time.